Those numbers take your breath away. They really do.
We are seeing a disparity because right now, slightly more than 70% of all of our deaths are among African Americans, who make up about 32% or so of the overall population of our state. So obviously this is a big disparity, and we're going to try to figure out what that is attributable to and what we can do about that as quickly as possible.
Milwaukee's population for African Americans is about 47%. But then when we get to where we're at right now for the case percentage, it's about 50%. For those that are in the hospital, it's about 62%. And for those that have perished due to COVID-19, it's about 87.5%. So you can see where we're going here.
30% of Chicago is Black, 52% of our cases have been in Black Chicagoans. And most strikingly, 72% of our deaths here in Chicago residents have been in Black Chicagoans, though again, Black Chicagoans just make up 30% of the city's population.
This is a call to action moment for all of us. When we talk about equity and inclusion, they're not just nice notions. They are an imperative that we must embrace as a city. And we see this even more urgently when we look at these numbers and this disparity. It's unacceptable. No one should think that this is okay. And we have to step up in this moment and step into it.
This disease is affecting people disproportionately in lower income communities, in communities that have had more health problems historically, and in communities of color.
We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately afflicting the minority populations, particularly the African Americans. Unfortunately, when you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs, that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population.
And I thought he should collect a lot more data and make it mandatory, the collection of data nationally on those African Americans who are contracting the disease and dying at a much higher rate than other folks.
Some underlying health conditions and disparities are part of the issue here. But I mean, we heard Congressman Cedric Richmond say as well that this is rooted in years of systemic racism. Aren't there other forces at work here?
Well, you know, that's rhetoric, and it may be, but as a physician, I'm looking at science.
You're saying that's just rhetoric?
Fundamentally, the community conditions, the holes in our social safety net, differing economic, educational opportunities, and fundamentally the systemic and institutional racism that have driven these inequities over the years, we are now seeing play out in our COVID data.